Welcome to the Prevention Platform, where our goal is to equip you with the knowledge and tools you need to prevent problems before they occur. Here at Valley Youth House, we believe that prevention is key to living a healthy and successful life, and we are excited to share our expertise with you. We hope that you find our discussions informative, engaging, and relevant to your own parenting journey. So sit back, relax, and let's dive into the world of prevention together. In today's episode, we explore the topic of opioids, which is a subject that has become increasingly significant over the past few years. As opioid addiction and overdose rates continue to rise, understanding the impact and where to get help locally has never been more important. I am joined by Molly Stanton, who is the Assistant Administrator for the Department of Drug and Alcohol in Lehigh County. I'm here with Molly Stanton, who is the Assistant Administrator for Lehigh County Drug and Alcohol. Today we are talking a little bit more about the opioid epidemic and in honor of September, which is Opioid Prevention Awareness Month. Molly, welcome to the Prevention Platform.
Thank you. I'm happy to be here.
So can you go ahead and tell us a little bit about the Department of Drug and Alcohol in Lehigh County and what functions do you serve?
Yes, I'd be happy to. My boss and I always joke that we're the best kept secret in Lehigh County. So the Single County Authority, which is another name for our department, is tasked by the state and the county with offering prevention, intervention, treatment, and recovery support services to people that have substance use and alcohol problems in Lehigh County. And that's a pretty wide umbrella. That's everything from our student assistance program that operates in the schools to funding people without insurance that need to go to treatment, sometimes even funding people that have very high deductibles and couldn't afford to go to treatment otherwise, to be able to pay down that deductible and access, usually residential, sometimes outpatient though as well. That also means recovery supports is a broad umbrella. We operate right now 2 recovery centers in Lehigh County, both in Allentown, that are kind of drop-in centers where people can present to have a safe place to be if they're using. They can get resources, have some case management to help them apply for benefits, spend some fun time with other people in recovery, and so we have job fairs at those. There's workshops for people that are wanting to get their criminal records expunged. So it's kind of a little bit of everything. We just are expanding one into a program that serves children and their families. And we put it that way because it's targeted towards pregnant women and women with very young children. But we also started to recognize that there were fathers, single fathers, grandparents raising children of various ages, and they really need a lot of resources to maintain their recovery and also kind of put their family back together. So that's all in our recovery supports. We offer through Danny's Ride, transportation to treatment when necessary, and in some limited circumstances, we can support recovery housing.
So you are very busy here, and I can
Absolutely.
see why you would consider yourself the best kept secret, because I think a lot of times people aren't aware that these resources exist. So if somebody was interested in accessing some of these resources, how would they go about doing that?
They can contact us at the county. I answer a lot of questions all day long from people as simple as, I don't know how to get into treatment myself, or I'm a family member and I need some coaching to help my loved one get into treatment, or some assistance for myself in coping with this problem that's in our family. So the first step is really to contact us. If you're seeking treatment, the first step is to get an assessment, and that assessment will determine your level of care, and that provider will help you to apply for our funding if necessary, Medicaid, and any other supports that you might need.
Thank you for that information. So let's shift our focus a little bit over to opioids and really kind of the reason why we are here today. So if you could, Molly, in your own words, share What are opioids, and why do you think they are a problem?
Opioids are a class of drugs that are both illicit and prescription. Prescription opioids are the sort of things that are prescribed for pain management. You might get them for a period of time after surgery or if you've had an injury, and those things have a very strong pain relieving effect. Unfortunately, for the addiction component, they also have a very strong euphoric effect and suppress respiration and some other sorts of things. And no one really fully knows why opioids are so much more powerfully addicting than other substances. The best guess that I've read is that your body has opioid receptors, and your body makes its own endogenous opioids. It's why if you have an injury, you stub your toe, and there's a sharp spike of pain, and then within a couple of seconds, that pain starts to ebb. It's because your body has produced and started releasing its own analgesics that sit on opioid receptors in your body. The opioids that we have now, a lot of what's in our substance market right now is laboratory created, so they're not even from like the opiate poppy. They're very strong opioids that are made in a lab. Fentanyl is the one people have probably heard of. And those opioids are like 100 times more powerful than your basic heroin. As such, they really dramatically can repress respirations, and that's why people have been overdosing on them. And part of the driver of the overdose epidemic is both the overprescription of opioids that happened for decades leading up to the epidemic kind of becoming into public awareness, and the extreme power of the current lab-created opioids that are in our market. And not just when people think they're buying heroin, they're mostly getting fentanyl, but they're lacing other drugs that people purchase with the fentanyl. That includes cocaine, amphetamines, methamphetamines, and occasionally even marijuana.
And some of the questions that I've had people ask is, should they be concerned about drugs that they're getting prescribed to them by their doctors? What does that look like?
People should ask a lot of questions if they're being prescribed opioids by a doctor, and should offer information. So addiction has a genetic component. So there are some people that are at higher risk of developing an addiction, and other people that are more resilient to having an opioid in their system. And if you have a family history of alcoholism or any other addiction, you should let your doctor know that. Because the risk for you as a person being prescribed those opioids is greater than someone with no family history. And you can ask if you're concerned about being prescribed an opioid and how you might respond. You can ask, how long are you going to be prescribed this medication, and are there alternatives on an opioid? So it's important to have an open conversation with your doctor. The medical profession has reduced the prescription of opioids in response to the opioid epidemic, and they've become a lot more aware and educated about the risk factors of prescribing these medications for people. But your health care is also primarily really your health care, and you should have a voice in that, and you should be bringing your concerns to the table with that medical professional.
Absolutely, and I think that's a really great point to make, that those conversations have to be had, and sometimes we really need to advocate for our own health, knowing our history and knowing what types of things we can become addicted to. In terms of what you are seeing in Lehigh County, can you share a little bit about how opioids have impacted your residents?
Lehigh County has been one of the counties that's fairly hard hit by the opioid epidemic. Pennsylvania as a state has been very hard hit. I think at peak we were like the 14th most severe rate of addiction in the state, or in the United States. And in 2022, Lehigh, Pennsylvania itself, saw 5,158 opioid and drug-related deaths. That's about a person every 2 minutes that is overdosing. And we had 163 overdose deaths in Lehigh County. And about 84% of those overdose deaths are related to opioids. And when they do a toxicology report, 76% of those opioid deaths were fentanyl related. So that's what they're finding in their drug screens. On the good news side, because that sounds really, really terrible, but on the good news is we've seen a 4% decrease in opioid-related deaths since 2021 in Lehigh County. So just in a year, we've had a 4% drop. Not sure, it's hard to collect data on why that is, but one thing I hear from our EMSs is that we're getting some good saturation with our naloxone efforts. That most of the time now when EMS responds to an overdose, a bystander has already given a dose of Narcan. The big thing we're seeing an uptick in our drug supply, and most of these are, a lot of the deaths aren't single substance. So you may find cocaine, methamphetamine, other substances in the person's bloodstream at time of death. And what we don't know is whether that person knew that they were taking an opioid when they overdosed, because the supply is so contaminated with fentanyl. In some ways, people are intending to use one drug and they're being poisoned by another. I think it's a way to really look at it and wrap your head around it, that this is like fentanyl poisoning.
So even as we're trying to address the opioid epidemic, you're seeing more and more substances that are finding their way to people, and perhaps they're even more deadly than some of the opioids that you're seeing.
It certainly can be a combination. And if you don't know that it's in your substances. And that's some of our own prevention and intervention efforts are focused on not only handing out naloxone, but our county, through Change on Hamilton, is also distributing fentanyl and xylazine testing strips. Because if people are going to use substances, it's a way of showing them what's in their substance so they have a choice in whether they put that substance in their body, with the goal of keeping them from overdosing long enough for them to seek treatment. Mm-hmm. So when they come to get test strips, they're interacting with staff at Change on Hamilton or other providers who we've given the test strips to that are distributing to people that are in precarious areas so that they can begin testing their substances.
And for listeners who aren't aware, can you just really quickly talk about Narcan and what that is and what it does?
Narcan is a brand name for naloxone, and naloxone is an agent that reduces overdoses. Last year we handed out just over 4,000 Narcan kits in Lehigh County, which is a lot of Narcan. We're on track for about that amount again this year, but it is comes in a nasal spray kit. Each kit has 2 nasal sprays in there, and if someone is overdosing, it works like other nasal sprays that you're familiar with from over-the-counter medications. And you simply put the nozzle in the person's nostril and press the pump and wait for a couple minutes, see if they respond. If not, give them a second dose. There's no risk for administering the Narcan, even if you give someone Narcan who wasn't in fact overdosing. It is benign. It's not going to cause them any harm. It doesn't really do anything dangerous. So you're at very low risk for misadministering it as a bystander. And but you can save somebody's life if you carry it and administer someone.
Knowing about Narcan is so important, and along with that, the Lehigh County Department of Drug and Alcohol has partnered with Valley Youth House to expand our prevention efforts with regards to opioids, and we are going to be launching an opioid prevention campaign. Can you talk a little bit about that campaign?
Yes, we're very excited about this because, again, I started off saying we're the best kept secret in Lehigh County, and we really offer a lot to our community, both in terms of prevention and in terms of intervention and treatment. But finding us on our website is sometimes a little difficult if you don't know the exact search terms to put in, and not all the information that somebody would want or need is in one place, and is a kind of a landing page for various sorts of public service campaigns that we plan to do through Valley Youth House in partnership. So one of the earlier campaigns that we want to do is Narcan awareness and how people can access this medication and how people can get that. And that's going to consist of building out this like really beautiful, very informative, interactive website that is a one-stop shop for everything that you're going to need to know about Lehigh County drug and alcohol and the services available both through Valley Youth House and through the county itself. Narcan is going to be front and center for that in some of our early campaigns. And I'm really hoping that people take advantage of the resource and start to carry. It's even important if you don't think that you have someone in your house that has an addiction. If you get or someone in your home is prescribed opioids, it's a good idea to have a double kit of Narcan in the house. Because what if you take your medication, forget you took your medication, and take a second dose? You may not have intended that to put you in a dangerous situation, but it very well could. So to be able to have everyone in your home trained on how to use Narcan, knowing where it is, and how to respond if you accidentally double up your medication.
But thank you for all of that, Molly. This was very helpful. It was very informative. We are looking forward to our campaign, and the theme of that campaign is Rise Above. We are talking about how in Lehigh County we can rise above opioids, we can rise above addiction, and the focus is really bringing the community together in terms of doing that and saving lives. So thank you for joining us.